A very good morning, dear students. This is our next topic of the chapter Nutrition and Health. In this video lecture, we are going to study about balanced diet, nutrition, and malnutrition and its prevention. So, let's start with balanced diet. What is balanced diet? A balanced diet means getting the right type and amount of food and drinks to supply nutrition and energy for maintaining body cells, tissues, and organs, and for supporting normal growth and डेवलपमेंट। सो एक बैलेंस डाइट जो होती है उसके क्या क्या पार्ट होते हैं, उसके बहुत सारे कंपोनेंट्स होते हैं जो कि हमारी बॉडी के लिए ज़रूरी होते हैं, जैसे कि विटामिन्स एंड मिनरल्स, प्रोटीन्स, फैट्स एंड कार्बोहाइड्रेट्स। इन सब के बारे में डिटेल में हम लोग अपनी प्रीवियस लेक्चर्स में पढ़ चुके हैं। अब एक बैलेंस डाइट की इम्पोर्टेंस क्या होती है? द इम्पोर्टेंस ऑफ बैलेंस डाइट, इफ वी हैव टू summarize in points, are first one is that it enhances the ability to work. The second one is it helps in growth of the body. Balanced diet enhances the immune system of the body and it increases the ability to fight against diseases. Balanced diet leads to good mental health and physical health. Exercise, intake of carbohydrates and refined should be avoided, which affect the physical health. Now let's move on to malnutrition, under which we are going to study about its consequences, causes, preventions and control. So what is malnutrition? Malnutrition is defined as imbalance between the body's need and the intake of nutrients, which can leads to nutritional disorder. So intake of nutrients in proper amount is needed. The World Health Organization defines malnutrition as the cellular imbalance between the supply of nutrients and energy and the body's demand for them to ensure growth, maintenance and specific functions. Malnutrition, undernutrition, growth failure, micronutrient malnutrition. There are basically two types of malnutrition. The first one is undernutrition and the second one is overnutrition. In undernutrition, nutrients are undersupplied, and in overnutrition, nutrients are oversupplied. Both causes nutritional disorders. Nutritional deficiency occurs when the body is not getting enough nutrients such as vitamins and minerals. There are a number of conditions that are caused by nutritional deficiencies such as anemia. The body requires vitamins to stay healthy and function properly. While vitamins can be found in the food we eat, sometimes that is not enough. Some people may have a greater need for certain vitamins. Increasing the intake of nutrients can alleviate symptoms and conditions. Multivitamins and mineral supplements are commonly taken. So now let's move on to the causes of malnutrition. The main cause is the lack of food. This is common among the low income group as well as those who are homeless. The second one is those having difficulty eating due to painful teeth or other painful lesions of the mouth. Those with dysphagia or difficulty swallowing are also at risk of malnutrition. This could be due to a blockage in the throat or mouth or due to sores in the mouth. Loss of appetite. Common cause of loss of appetite includes cancer, tumors, depressive illness and other mental illness, liver or kidney disease, chronic infections, etc. Those with a limited knowledge about nutrition tends to follow an unhealthy diet with no enough nutrients, vitamins and minerals and are at risk of malnutrition. Elderly living alone, disabled persons living alone or young students living on their own often have difficulty cooking healthy balanced meals for themselves and may be at risk of malnutrition. As stated earlier, the primary cause of malnutrition are low income, low purchasing power. As the persons are unable to purchase goods which are having nutrient value required for proper healthy functioning of body. Now the next one is the ignorance and erroneous food habits. Like most of the youngsters, as you can see, prefers junk food over healthy foods. So this one is also an major cause. The next one is the scarcity of food supply. This is major problem for underdeveloped countries. The next point is overpopulation, which is a challenge for countries which are in developing state, as the population is more and the resources are limited. So this one also act as one of the major cause for malnutrition. Now the secondary cause. Secondary cause includes obesity, insulin resistance, and diabetes. Next one is diarrhea and intestinal malabsorption. So due to poor absorption, the nutrients didn't get properly absorbed into the body. The next one is hepatobiliary disorders. After that comes metabolic and renal disease, infections, especially respiratory, disorders due to malnutrition. As we have also studied this earlier in our chapters, like protein energy malnutrition, Kawasaki, Marasmus, we have studied them about earlier. So now let's talk about undernutrition of vitamins and minerals. Under this comes obesity. Here you can see various nutrition and vitamins and minerals due to which undernutrition occur. Here in the table given below, you can see undernutrition occurring due to minerals, and in the second one, undernutrition occurring due to vitamins. Under minerals, the first one is calcium. Due to undernutrition of calcium, the disease which occurs is rickets, and due to iodine deficiency is goiter. Due to iron deficiency is anemia, and due to zinc deficiency is growth retardation. Now due to vitamins are beriberi, which occurs due to deficiency of thiamine, also known as vitamin B1. The next one is niacin, that is vitamin B3. Pellagra is the disease which occurs due to its deficiency. Due to deficiency of vitamin C, scurvy occurs, and due to deficiency of vitamin D, rickets occur. Now you can see the disease which we have also studied earlier in our video lectures. Due to protein deficiency is Kawasaki. Now let's revise it. Here you can see in the picture the clinical manifestation which are visible physically. It occurs on the child between the age of 1 to 3 years. The etiology of the disease is as following. First one is very low protein but calories from CHO in place where starchy food are main staple, never exclusive dietary. The symptoms of the disease includes edema, muscle wasting, hair changes, depigmentation of skin, and moon face. The next one, which is also is the manifestation of low protein intake in diet, is marasmus. It commonly occurs in first year of life. The etiology of the disease is as following. The first one is balanced starvation, insufficient breast milk, dilute milk mixture, or lack of hygiene. The symptoms to the disease includes muscle wasting, growth retardation, mental change, and there is no edema as you have seen earlier in Kawasaki. Variable subnormal temperature, often diarrhea. The next undernutrition disease is thiamine, that is vitamin B1 deficiency, which results in beriberi. It is biochemically accumulation of pyruvic and lactic acid in the body fluids, which ultimately leads to cardiac dysfunction such as cardiac enlargement, especially right side, edema of intestinal tissues, degeneration of myelin of axon cylinders, resulting in peripheral neuropathy and weakness of eye movement, ataxia of GAD, and mental disturbance. There are two forms of beriberi. The first one is wet beriberi, which is generalized edema, acute cardiac symptoms, and prompt resources to thiamine administration. The second one is dry beriberi. Under this, the edema is not present and neurological. The next one is riboflavin, vitamin B2 deficiency. The function of vitamin B2 is that it acts as a coenzyme of flavoprotein and is important in AAFA and CHO metabolism and cellular respiration. It is also needed by retinal eye pigment for light adaptation, and the clinical manifestation which occurs due to it is as following.